very common procedure or very common question I get is mini lift versus facelift. And the true nature of this question is a little tricky. Some of it is honestly just marketing mumbo jumbo, because at the end of the day is what exactly are you doing with each procedure and what exactly are you targeting with each procedure? In my hands, a facelift is an extended deep plane facelift. What does that mean? That means that we're releasing the ligaments all the way from the top of the cheek down into the neck. So we're picking up this whole area of the face as well as tightening up the platysma muscle underneath it, and that helps delineate the jawline. The difference between a mini lift, where we are doing that, along with a traditional cheek neck lift, is that in a cheek neck lift, we're also doing a platysmoplasty. In the platysmoplasty, we take a little incision underneath, right here under the chin, 2-finger breath, and then we open this area up just from that little incision, and we take a look at the muscles down below. And if you're imagining a coat, almost like a blazer coat, we're opening up that blazer, which is the muscle in this case, taking a look underneath, cleaning out the fat, taking a look at the glands on each side, trimming them down so that we can suck them up and get that contour really nice along the way. And then we're tightening up that blazer right back to where those muscles used to be in your 20s and 30s. That allows us to get that really nice contour along the neck. It looks super nice, really, really snug and tight. Then we're tightening up along the sides, as I mentioned before, with our extended deep plane facelift. The advantage of this procedure is very natural. We're repositioning muscle, meaning we're not getting that windswept look. We're not pulling on the skin really, really, really tight. That's old technique, and that allowed us to pull things really, really tight horizontally, whereas now we're going more vertical. We're following the direction of the muscles of the face. When we do that, we end up making our incision that starts in the temple and goes inside the ear, behind the ear, real nice and high, and back into the hair. That way you can wear your hair in a really high, tight ponytail. Nobody's ever gonna see any of the incisions, any of the scars. Everything looks super natural. Downtime is a legitimate 2 weeks. Patients come back and say, Miguel, you probably should have said 3. But it's an honest 2 weeks. You can put a little makeup on. You'll feel a little funky, honestly, but you can go out to a restaurant. Nobody's gonna notice anything. And shortly after, within those 3-4 weeks, you're back to normal. So within a few short weeks, you're back to your normal behavior. So it's a great procedure. With new modern techniques, we heal very fastly, and the best part of it, nobody can tell.